Accountable care is a group of healthcare providers taking on accountability for the results of care for a population of patients. Accountable care shifts the focus away from providers and traditional healthcare and puts it right on what matters most to improving patient outcomes and keeping healthcare costs down. One of my early meetings when I was the administrator of the CMS was with leaders of some healthcare organizations who were taking a whole lot of new steps to try to keep their patients healthy. They were doing things like adopting team-based approaches to care and electronic reminder systems and steps to coordinate care for people with chronic diseases. But they pointed out that because of the way Medicare policies were set up, they were not getting any support for implementing these reforms. But the most important thing is thinking locally and thinking about care improvements from the patient standpoint. And so another key principle for implementing accountable care is to start incrementally. The pilot in El Waqra represents a new combination between the Primary Healthcare Corporation, the Hamad Medical Center, the Ministry of Public Health, all working together with this patient focus on identifying the risk factors for diabetes, engaging patients early, and delivering coordinated care throughout the whole spectrum of care needs that a diabetic patient might have. What we really appreciate is the opportunity to have a real impact. WISH is not just about exchanging ideas, it is about supporting implementation. There are two big advantages of working with WISH. One is that it is a global forum. It truly brings together leaders from the entire spectrum of nations around the globe. And the second big advantage of WISH being based here in Qatar is the close connections between WISH and the goals of health improvement in Qatar. And so the model that's being developed here, I think, has a lot of applicability in the region and around the world.